In Fox 5 Health News, and Pfizer says its vaccine in kids under 5 is 73% effective.
All right, joining us now, Dr. Serge Sauger, Chief of Infectious Diseases at Holy Name. Doctor, thanks for being with us. We do know that the vaccine numbers, though, for children under 5 have been especially low. Can you walk us through that before we get into
You're absolutely right, Steve. So, hi, Steve and Laura. According to the American Academy of Pediatrics, only about 6% of all children that are eligible, that is over the age of 6 months and under the age of 5, have actually received even one dose of this vaccine. So remember, this vaccine was approved based on data showing it was extremely safe and that it was very effective at producing antibodies. However, how that translated into its efficacy, how efficient it was at preventing symptomatic disease, was still a little unclear. Pfizer is now talking and now revealing what we call post-marketing or phase 4 data that shows that, yes, indeed, it's extremely effective, 73% effective compared to placebo, those that did not receive the vaccine in preventing disease. So hopefully this extra data, it's already proven to be safe, already proven to produce antibodies, but now the real world data that's very effective at preventing symptomatic disease, again, 73%, will hopefully increase the uptake of this vaccine, which up until now, again, remember, it was only approved in this age group in early June, has been considerably low, very low, and especially with the fall, cooler weather returning back to school, we would like to see increased vaccine uptake rates in that population.
What variants does it cover?
Sure, so it was initially designed for the BA2 subvariant of Omicron. As we now know, BA4 and BA5 in particular are the predominant strains in the United States. However, this vaccine has held up very well. I should mention that Pfizer's already asked for their new updated booster that's now targeting Omicron subvariants for ages 12 and over to be approved in the fall, and they do have told us that they are now working at a updated Omicron-specific vaccine for the under 12 population as well. But first, we need to see increased uptake in this most youngest, and again, very vulnerable age group.
Gotcha, makes sense. All right, well, an alarming trend, a new study finds advanced cervical cancer is on the rise. Walk us through this, Doc.
Right, so this is basically looking at a study, Journal of American Gynecology, Cancer, and what they found is that the rates of, it's almost paradoxical, the rates of early cervical cancer are actually decreasing. But the rates of late or metastatic, what we call stage 4 cervical cancer, are increasing. Now, we still see, like a lot of other medical conditions, medical disparities, where the prevalence, that is, the overall number of cases are the highest in minorities, African Americans, Hispanics, etc. But if you look at the rate of rise, somewhat surprisingly, it's actually in white non-Hispanic women, particularly the ages of 30 to 34. So why is that? Remember, cervical cancer, when caught early, is extremely treatable, and it is very preventable, right? With screenings, with regular pap smears, testing for HPV, as well as HPV vaccinations. This is a highly treatable and preventable disease. What we are seeing is that it's perhaps young, healthy women are feeling healthy, are perhaps foregoing regular screening. I think this just reiterates the need. And remember, both the American Cancer Society as well as other governing bodies recommend anyone between the ages of 21 and 65 have annual gynecology exams. Depending on your risk factors, depending on the presence or absence of HPV, you get screened for cervical cancer every 3 to 5 years. This really just reiterates the need for accessible screening, healthcare, vaccinations for all cancers, especially for cervical cancer. This is somewhat alarming. We don't see increasing rates in colorectal cancer, breast cancer, lung cancer like we do here. So this is a very important study indeed. And again, it just reiterates the need that we have to remain vigilant and continue screening as appropriate.
Indeed. Yeah. All right. Dr. Serge Sauger joining us tonight. Good to have you on. Thank you.
Thank you.